Inhalers add $5.7 to U.S. climate costs. Healthcare decarbonization emerges as a cross-sector priority. A decade-long analysis published JAMA reveals the U.S. healthcare sector's growing contribution to greenhouse gas emissions, underscoring an urgent need to integrate sustainability into medical product design and procurement systems. The study, Inhaler-Related Greenhouse Gas Emissions in the U.S., quantified the climate footprint of 1.6 billion inhalers dispensed between 2014 and 2024. Researchers found that these products generated 24.9 million metric tons of CO2 equivalent, CO2e, a total social cost of $5.7 billion and a 24% increase in annual emissions over the past decade. Inhalers are essential for treating asthma and COPD, but their propellants carry a climate burden that has been largely invisible, said Dr. William B. Feldman, lead author and pulmonologist at UCLA, in the study. Metered dose inhalers drive emissions spike. Metered dose inhalers, which use hydrofluoroalkane (HFA) propellants, accounted for 98% of all inhaler-related emissions. While hydrofluorocarbons replaced ozone-depleting chlorofluorocarbons in the 1990s, they remain potent greenhouse gases. 3 drugs, albuterol, budesonide formoterol, and fluticasone propionate, were responsible for 87% of total emissions, with GSK, AstraZeneca, and Teva manufacturing the majority of products. The report found that brand-name inhalers produced 72% of emissions, suggesting that future reform efforts must include both patent-holding companies and generic manufacturers. When scaled, the study's findings equate to the annual electricity use of nearly 470,000 homes, or the emissions from 530,000 gas-powered cars, a significant footprint for a single medical product category. From pharmaceuticals to policy. Aligning with Kigali goals, the U.S. federal government has committed to reducing hydrofluorocarbon use by 85% by 2036 under the Kigali Amendment to the Montreal Protocol, a phase-down already influencing refrigerants and industrial gases. That same regulation now intersects with medical and pharmaceutical supply chains, linking hospital systems, insurers, and pharmacy benefit managers to the broader decarbonization agenda. Policy experts argue that sustainable transitions in healthcare, mirroring those in HVAC and building sectors, will require coordinated procurement policies and investment in low global warming potential propellants. Globally, the UK's National Health Service and the European Union have integrated inhaler emissions into net zero frameworks, providing a model for how the U.S. might align future pharmaceutical standards with environmental regulations. Decarbonizing clinical supply chains. While inhalers represent less than 0.5% of total U.S. healthcare emissions, the study identifies them as a scalable test case for product-level climate accountability. The findings reinforce a wider call for ESG integration across health systems, where sustainable procurement, material innovation, and Scope 3 accounting are becoming standard practice. Opportunities for progress include transitioning to dry powder or soft mist inhalers, which generate up to 99% fewer emissions. Accelerating FDA approval for low GWP propellant technologies currently in clinical trials by GSK and AstraZeneca. Expanding public-private collaboration to align healthcare purchasing with emissions reduction targets. This is about balancing patient safety, affordability, and environmental stewardship, Dr. Feldman noted. The technology to reduce these emissions already exists. The challenge is scaling it. Product-designed regulatory policy. For sustainability leaders in pharmaceuticals, manufacturing, and corporate ESG, this study highlights how product design and regulatory policy intersect in reducing emissions. Healthcare's path to decarbonization parallels transitions in energy, transportation, and construction, where incremental innovation can yield exponential climate benefits. As other sectors move toward net zero, the healthcare industry's emissions, long considered outside traditional energy discussions, are now squarely part of the sustainability equation. You've been listening to Sustainability Soundbites presented by E+E Leader. For partnership opportunities, reach out to a member of our team.